Welcome back to the show. Big news this afternoon. The Centers for Medicare and Medicaid Services announcing there are 6 million sign-ups, 6 million, up from 5-10 days ago for Obamacare. With me now, Avik Roy, Senior Fellow at the Manhattan Institute, to talk about the details. What do you make of these new numbers?
So there are two things that we don't know from the Obama administration. 6 million people have signed up for plans on these exchanges. How many of those people, number one, have paid? Because you don't actually have insurance coverage until you've paid the first month's premium.
And Avik, as we found on this show, you can pay and you still may not have coverage.
Absolutely right. So the estimates we have from a lot of different surveys suggest that about 20% of the people who've signed up haven't paid, and it's a much higher number among the uninsured, which gets me to the second point, which is we don't know how many of the people who've signed up for the Obamacare exchanges were previously insured or previously uninsured. And all the data we have thus far suggests that it's a minority of people who've signed up for Obamacare who were previously uninsured, which was the whole point of this law, right, to get the uninsured coverage.
They might have coverage. It's worse than that even. We're starting to see that people still don't know about the deadline, even now, even when March 31st is Monday, and people who are uninsured don't want to play.
Yeah. Yeah, and that's the whole thing. So when you hear people say, well, 6 million people have enrolled in Obamacare, that's not true, because just because you've signed up doesn't mean you've enrolled. And number two, just because you enrolled doesn't mean you were newly covered by Obamacare. There are a lot of people whose plans are canceled who now are signing up for Obamacare, but that's not necessarily an improvement for them. For some of them it might be, but for others they're paying more money for less coverage than they had before.
61% of the uninsured didn't know the deadline was March 31st. How about that? And missing the uninsured, the Kaiser Health Tracking poll has those who plan on staying uninsured at 50%, 50. Shocking, shocking numbers that just confound me when this was the whole reason we were doing this in the first place.
You know, one thing that's actually very interesting, Gallup has done some good work on this. What's interesting about the polls around Obamacare is that the disapproval rating of Obamacare skyrocketed among the uninsured. It used to be that disapproval was around 24% about, say, a year ago. Today, more than half of the uninsured disapprove of Obamacare because they're the ones who found that the plans are a lot more expensive than they thought they'd be, that they cover a lot less than they thought they would, et cetera, et cetera.
Well, we had some shocking revelations from Harry Reid about why he thinks this program is going so badly. Here's Harry Reid.
There's no hiccup or delay. We have hundreds of thousands of people who tried to sign up and they didn't get through. Reminds me of why we had to extend this time. There are some people who are not like my grandchildren who can handle everything so easily on the internet. And these people need a little extra time.
Well, I guess we're all too stupid for Obamacare. That's what it is. We're not those elites who can understand the web. That is just insulting.
Well, you know, that's been the whole kind of left-wing philosophy of healthcare for a long time, is that people are too stupid to make these choices for themselves. That's why we, the experts in the government, should do it for them. And I think Senator Reid, in his kind of Asperger's syndrome way, is expressing that viewpoint.
But you can build on that, because I think part of what's going on is they assumed that the uninsured would want coverage and would want to pay for coverage. Maybe not. Maybe they don't want coverage. Nobody asked them. They just assumed these people would. It was a gift they were giving the uninsured. It was something they were doing for America. And at the end of the day, nobody wanted that present.
Well, you know, some people might want it if it's free to them, but if it's not free to them, it's a different situation. A lot of the people who are uninsured are young and healthy people for whom the Obamacare plans are too expensive. If you're 27 years old in perfect health and you don't qualify for Obamacare subsidies and you're now being expected to pay $300 a month for a health plan that has a $5,000 deductible, why would you do that?
Democrats now suggesting we need another level. You know, we have those precious metal levels, platinum, gold, silver, bronze. They want to add copper. And I think their idea is that we're going to make it look like it's less expensive, it's more affordable. Is this a good idea?
I actually support that idea. I think that is one thing that you could do to improve Obamacare, would be to give insurers more flexibility to offer plans with what would be called a lower actuarial value. So the co-pays might be higher, the deductibles might be higher, the payouts might be lower. That would drive the premiums down and create a new category or tier of plans that would be affordable for the people who don't qualify for the subsidies. So I do think that's a good thing. I think there are a lot of other things you can do to drive down the cost of the plans on Obamacare, but not everyone on the left will support those ideas.
And maybe not everybody on the right, because if you're driving down the cost of the programs, maybe you're increasing the cost for taxpayers. Chuck Schumer, Senator of New York, had this to say about what's going on. He said 85% of Americans, hey, Obamacare means nothing for them. I think he's trying to draw attention away from the disaster that is this program.
Yeah, that's also been something the White House and other people have propounded for a long time, that, well, for those of you who get insurance through your employers, people who already have coverage, this law does nothing for you. It's that whole if you like your plan, you can keep it idea, right? But that's not true. So a lot of people's old plans who are employer sponsored, and we've talked about this on the show, their old plans are illegal now. And the new plans that are Obamacare compliant that they're going to have to get from their employers are going to cost them a lot more money. It's called the Affordable Care Act, but insurance is going to be more expensive under this law, and people are already experiencing that.
Avik Roy, always great to see you. Thanks for coming on the show.
Thanks a lot.
Great to have you here.